This has been a great couple of days for me, so many academics and development professionals in the room. It's not really my background. Not really sure I belong here, but no Appalachian thinking going on here. I spent the first decade of my career right here in Washington, D.C., working for a couple of Wall Street law firms, and then I worked for the Clinton administration and then in 1997 I moved to Hong Kong to work with Morgan Stanley. And eventually I became Morgan Stanley's chief financial officer in Asia Pacific. I was overseeing all the financial affairs of a multi-billion-dollar Asian financial services firm. And but on nights and weekends I invested heavily in a charity in the Philippines that fights poverty. And so then 2 years ago I left the business world completely in order to focus on poverty reduction full time. And in this capacity, I kind of represent a group of Asian investment bankers who want to help the least fortunate. For those of us who live in Asia and we travel from city to city to city, we are constantly confronted by poverty. There are more extreme poor in Asia than almost twice as much in Asia than the rest of the world put together. So by sheer numbers, we kind of feel that extreme poverty is primarily an Asian problem. So we started by focusing on the Philippines as an incubator about how to address ultra-poverty. So we leverage on a charity that is called International Care Ministries. It exclusively works with local churches in the country, and ICM has grown explosively. Now it is one of the largest local charities in the Philippines. And we've chosen to focus our efforts specifically on the ultra-poor people in the Philippines. That is, those people who live on less than 50 cents a day. And investment bankers like us, we kind of have a voracious appetite for metrics. So over the last decade, we've accumulated about 40 million data points from the poorest people in the Philippines. And our data shows that among our target population, those that earn less than 50 cents a day, that the average daily income is only 26 cents a day. That most of these people lived in cramped homes. They don't purify their water. They live without electricity. So the question then is, how can we use our business skills to address a problem of that magnitude? Well, in our business lives, when we evaluate a new venture, we usually look for two different things. First, we look for a great product that meets the need, and secondly, the ability to scale that product. So for the first, so when we decided how to work on that in the poverty area, after we needed a great product to fight poverty. So after nearly 20 years of experimentation, and we have had cycles of Hong Kong investment bankers, including investing more than $50 million of our own money, we have concluded that we can achieve the highest return on our own investment by using a faith-based distribution system. Now, that is a different conclusion than many other agencies come to, and we completely agree that aid needs to be delivered impartially, but many global agencies decide that they should be neutral with regard to religion, and they define neutrality as prohibiting the discussion of faith during the programs. But in our view, excluding the discussion of faith is not being neutral about faith. For most poor countries around the world, bringing a God-neutral message is not culturally appropriate. It is culturally inappropriate. It is people from a faraway land trying to impose their secular worldview on local people who deeply believe in the divine. So how does that play out for all of us? ICM has designed a church-based 4-month intensive program we call Transform. In each community, the local pastor and 6 members of his community invite 30 ultra-poor people to once-a-week training in values, health, and livelihood. And at the end of those four months, we see amazing benefits from this Transform program. The average family has a 95% increase in household income, 31% fewer people live with serious illnesses, there's a 27% reduction in those going to bed hungry, and scores of other improvements as well. And surveys after that time, up to 3 years after the conclusion of the 4-month program, shows that most of these improvements continue. You know, yesterday one of our presenters said that we should focus on 2 words, hope and dignity. And we completely agree. The most important single lesson that we've taken from these 2 decades of experience is that hope is the key to freeing people from poverty. People who live in extreme poverty, they experience extraordinary stress that can paralyze action. In ICM's communities, 24% of all mothers have had one of their own children die, and 8% have had more than one of their children die. That is an extraordinary amount of stress that can affect entire societies. We've concluded that the underlying causes of poverty are often rooted in fatalism and lack of optimism. The key is hope, injecting optimism. And faith communities are uniquely qualified in this area. Spiritual leaders are in the business of injecting optimism into people's lives. After Transform, our participants report that there's an increase in satisfaction of their families, and our regression analysis demonstrates that this factor, satisfaction with family life, is the single factor that drives the rest of the positive outcomes. For example, research shows that participants who improve their family relationships are more likely to guide their children out of malnutrition. Another bit of research we did said that strong family relationships make poor people to be more willing to be tested for tuberculosis. When people trust each other, they help each other. People share, lives are saved. And we just cannot underestimate the significance of hope. So as business people, hope is the product that we need to deliver in order to address ultra-poverty. So that leads to a second requirement. Then how could you bring hope to scale? Well, in the Philippines in particular, we have discovered that there are small churches on almost every Philippine street corner. And most of these churches are run by very, very poor pastors who are passionate about helping other people. Now, before ICM ever arrives, this local pastor already knows the first name of every person in their community. We've also discovered that pastors tend to be the most enterprising people in their entire communities. They start things all by themselves. But many of these people, they have chosen to live their lives based on gifts from their ultra-poor congregations, often only $2–3 a week for their entire family. And as a result, their entire families endure many, many hardships. But despite these struggles, most of these pastors are very grateful to work with us to help their communities. These pastors are our heroes, and we believe that it would be virtually impossible to replicate this church-based distribution system by using secular means. At great cost, a secular program could try to hire social workers to travel to visit all these poor families, but these expensive social workers would not have pre-existing interpersonal relationships in the community. In fact, our research shows that for the effectiveness of our trainers is inversely correlated with their level of formal training. For every additional year of our trainers' formal education, there is a 10% reduction in the effectiveness of the program. So we conclude that less educated local faith leaders will have more impact than highly educated imported social workers. Now listen, so what does scale mean for us? ICM focuses our efforts on 15 Philippine provinces with a total population of about 17 million people. These provinces contain 1.7 million people who live in ultra-poverty. We want to scale up our programs to reach these 1.7 million people. They are ICM's target audience. Now, just for context, in May of 2015, ICM graduated the 600,000th family member from this 4-month training program. That means we've reached more than 1/4 of all of the people, ultra-poor people in our provinces. And that is an astonishing amount of scale, and we think that would not have been even remotely possible without cooperating with local faith communities. But business people are not satisfied with just raw success. We want to compare our performance against an index or against a benchmark. So how can you to benchmark ICM's effectiveness? Perhaps the most secular poverty reduction strategy for ultra-poverty in the world that we're aware of has been run by BRAC. They've run 1 million family members in Bangladesh through it, plus that model is basically being piloted in a couple of dozen countries around the world. On May 15th, just 2 months ago, a 6-country randomized control trial was released. It was published in Science magazine, and it showed that this BRAC program works, and that the average family that goes through the BRAC program for 2 years earns about $300 of extra income for each poor family. But to bring this program to those poor families, it costs $1,000, $2,000, $3,000 per family. So to take 1 million poor families through a program this expensive would cost more than $1 billion. Now, in early 2015, ICM partnered with Yale University to run our first randomized control trials, and the statisticians are still analyzing the data. The findings will soon be prepared for publication, but our preliminary analysis shows that an ICM family would earn $361 more per year if they had not participated in our 4-month training program. That means that Transform also improved the satisfaction with family life and positive change in food security and access to water. And if you want to see fuller results, they only gave me 8 minutes, so they're in the appendix, which is all online. But if you compare ICM's results to the secular BRAC program, we are working with the very same researchers from Yale that studied BRAC, and our preliminary results indicate that ICM's program has a similar impact in freeing people out of ultra-poverty, $300, $400 per year impact on the families. But ICM incurs a little over $50 per family to deliver our program, not $1,000 per family. Thus, ICM's programs generate nearly a 50x, 50-fold better return on investment compared to the secular programs. And I want to emphasize that our results are preliminary. The statistician's still working, but the data does show an astonishing disparity in bang for the buck. Now, the question then is, how could ICM possibly achieve a similar result to the best-in-class secular programs in the world for only a tiny fraction of the price? That is easy. We think that faith-based distributions create scalable, high-impact solutions to poverty in a way that is impossible to replicate with secular means. And we think that leveraging on the local church networks have the potential for changing a lot of lives. If you just look at ICM's efforts over the last few years, our research projects that 41,000 people today have fewer suffer from hunger every week, 57,000 endure purified drinking water, 34,000 fewer live with scrapped roofs, more than 150,000 people have been freed from ultra-poverty. And many of you today, I know, are waging a war on poverty in your own faith communities, and we would look forward to a conversation and hope that this gives you a little ammunition as you explain to other people why the use of faith-based communities is important. Thank you.